As of Saturday morning, Johns Hopkins researchers reported the COVID-19 death toll in the U.S. was just shy of 1 million. The number once seemed unthinkable. Several media outlets and President Biden marked the threshold earlier this week. But when we hit that million mark doesn't really matter to the millions who have lost loved ones to the virus. What does matter to many people is understanding how we reached this point and what we can do to avoid repeating history. Joining us now is Dr. Jay Varma. He is the director of the Cornell Center for Pandemic Prevention and Response. Dr. Varma, thanks so much for being here. So tell us, how did we get to this point? What went wrong with the world's response to COVID-19 over the last 2 years?
So whenever we think about problems like this, and especially one that is absolutely devastating, when you think about the number of lives that have been lost and the many people who survived but are still suffering, is we think about threat and we think about vulnerability. And we did face a very formidable and continue to face a very formidable threat. Infectious disease experts like myself were very surprised that we had a virus that would transmit so effectively to people before they had symptoms, and that it would mutate so quickly. The flu virus takes about 5 years to become more dangerous. This virus takes about 5 months to become a new variant that's more dangerous. So we were up against a formidable threat. But the big story here is our vulnerability. Even though we were facing that threat, we could have done better had we not had, lack of trust in government and lack of trust in each other and politicized things that would have worked and continue to work. Masks, tests, quarantine, vaccines. And so we need to try to find a way as a society to pull together and reduce that vulnerability, because the threat's going to always be there, but we do have control over our vulnerability.
Well, when we're talking about a lack of trust and a polarized society in terms of some of the problems that we faced, those things don't seem to be going away. So what does need to change in order for us to be prepared for potential future epidemics?
Yeah, and this is a real struggle, because infectious disease experts like myself would love to talk about the technology. And I can be optimistic that, the U.S. remains a tremendous engine, probably the strongest engine in the world when it comes to finding new ways to innovate. We need, next generation vaccines that provide better, longer protection against new variants. We need tests that are easier to use. We need to figure out ways to clean our air faster and more effectively. So I have great confidence that the U.S. is going to be an engine of innovation for all the technologies we need. But the real challenge is this one about how do we turn that into practice? And I would like to change the discourse and hope that we can get people across the political spectrum to understand that public health is the same as public safety. People are talking about public safety a lot, about shootings, about mental health. But let's make sure that we put public health in that conversation and recognize that this is a common threat. How we do that is not so much a question for me as it's going to be for kind of all of us together to figure out ways to find common ground on these threats that are not just going away, they're getting worse over time.
You mentioned vaccines. According to the CDC, around 1 in 3 Americans aged 65 and older who completed their initial vaccine round still have not received a booster shot. Even as top health officials say it's now time to learn to live with COVID-19. Tell us why it's so important to get boosted, especially if you're in that more vulnerable group, 65 and older.
Yeah, we have learned that this vaccine works best when people have at least 3 exposures to it, and that's very standard. Just so people understand, there's lots of vaccines, whether it's polio or hepatitis vaccine, et cetera, that require multiple doses. Why is it so important? What we've learned as scientists over time is that your body actually defends itself better against this virus, especially severe illness and death, like being hospitalized and getting severely ill, if you've had 3 doses of vaccine. So, for example, if you take people who, got infected without those 3 doses of vaccine, and you compare them to people who got infected with the 3 doses of vaccine, the people with the 3 doses of vaccine, they'll still get some symptoms and they'll still get sick, but they won't get nearly as severely ill. And the other important thing we found is that protection against new variants is better if you've gotten those 3 vaccines. You still have not complete protection, but some protection.
I also want to ask you about masks. Which groups of Americans do you think should still be wearing masks in public?
Yeah, and this is one of the more challenging issues right now, right? Because we've moved from an era where we said everybody needs to do everything together, and now elected officials are saying, your health is something you need to take responsibility for. And that's difficult to do because as an individual, you rely on government to give you guidance. So what I advise my friends and family members and people I take care of is, if you have any medical conditions that put you at higher risk of severe illness, you need to be wearing a high quality mask anytime you are sharing indoor space with other people. Now you can consider relaxing those restrictions on yourself. If you know that everybody is vaccinated, you know that there's going to be good air circulation and ventilation, like the windows are open, so the meetings are outdoors in some way, and that people are getting tested regularly. Now, of course, everybody needs to choose their own level of risk tolerance, right? There are some people with higher risk conditions that don't feel that that's important, and of course, that's their choice. But I would really strongly recommend, particularly if you're elderly or you have any immune compromising condition, that you continue to use those basic protective measures.
BA4 and BA5 COVID-19 strains are driving the rise of COVID-19 cases in South Africa. However, officials are reporting that the rates of death and severe infections are relatively unchanged. So tell us, how concerned should we be about these variants? And what is your prescription as we're looking forward?
Yeah, and I think this is the way to think about this, is that this is just one chapter in a very, very long book with a number of sequels that isn't ending right now. And so what we're seeing is really that this virus is just finding new ways to threaten us. So the best things we can do right now are to get as many people with those 3 doses of vaccines, because as we mentioned earlier, that provides you with better protection against these new and emerging variants. That's number one. Number two is, it is great news that in places like here in New York City, that our death rate has largely remained unchanged despite the BA2 surge and now these new variant surges. At the same time, it's still making a lot of people sick. So the best thing we can do globally is to vaccinate as many people as possible, because the more people there are vaccinated, the fewer opportunities the virus has to infect people and create new variants. Otherwise, again, this book is going to continue to get new chapters added and new sequels written, and we're going to continue to find ourselves trying to chasing the virus rather than being ahead of it.
I think everyone's exhausted reading this book. Dr. Jay Varma, appreciate you coming on and appreciate all that you do. Thanks.
Thank you very much.